Representation in the healthcare field matters, specifically when it comes to people of color. A study by Stanford University found that Black doctors who treated Black patients were more inclined to write detailed notes, provide clear understandings of diagnosis, and find holistic approaches to curing illnesses. We're bringing back into the conversation to provide more insight on this, the Executive Director of the South Carolina Nurses Association, TK Curtis Pugh. Thank you so much for still being with us. Another shocking statistic. I know, growing up in Black culture, you always hear about wanting to go to a doctor that looks like you. Is your doctor Black? You hear that, but I mean, there is scientific data that proves going to someone that looks like you results in better results because they understand you more. But at the time, you just think that maybe that's just like an old belief in the culture. But it shouldn't be that way, but it is.
It shouldn't be, but the reason that is because historically we had separation in our hospitals. If you go back and look at the history of our state, we had places like the Columbia hospitals way before Richland was Richland. Yeah. And there's a group of nurses there right now who are the alumni of the Columbia Hospital, the Black alumni of the Columbia Hospital. And I got a chance to speak with a few of them as we're working on some things in the association. And to hear some of the stories about how women and patients in general were not heard by physicians that did not look like them and nurses that didn't look like them was really, really disheartening. But we have an opportunity now to really shift that narrative. And part of that comes from making sure that we find spaces for more providers of color to be able to get through programs. So there's a huge initiative happening federally right now with Title VIII funding. And what that is, in short, is figuring out in rural spaces, in spaces where we have people who are considered disenfranchised, people who may have a different socioeconomic background, those individuals, giving them access to being able to get into healthcare fields. In addition to that, we also have opportunities with organizations like AHEC, which is the Allied Health Consortium, Education Consortium, which is all over the state. Organizations like the Midlands Black Nurses that are doing a mini nurse academy, which is so nice to see elementary age kids getting to be exposed to see what nursing looks like, so then they can find a love and a passion for maybe wanting to do this as their career. So when we create those types of spaces, then we provide a roadmap for individuals to want to become healthcare providers. And in doing so, then we actually have a larger pool of candidates that can be providers for our patients.
And TK, there's a flip side to that racism, that structural racism. I do hear stories about people who have gone through medical school, they're Black doctors, Black nurses like yourself, and when their patient enters the room, some are asking where's the doctor, or they just refuse to be seen by them because of the color of their skin. Hard to believe that's still a problem in 2024.
It is. It's very prevalent. I've experienced it myself, having been a floor nurse for a numerous amount of time. There were years that I would go into a patient's room and they immediately thought I was the nursing assistant. Or when I was in leadership and someone had an issue with a nurse and they would call me because they wanted to see the manager or the director at that time, and I would walk in and they would look at me and be in shock that as a Black woman, I was the woman coming in. Or even someone saying to me, oh my gosh, you're really articulate for a Black woman. Wow. And this was a patient who said this to me. And I remember saying to her, I thank you for that. How can I help you? Because I'm here to help you and serve you. And we have to work on changing that narrative, but it also means we have to be in the spaces. You can't change a space if you're not in it. I always say, if you're not at the table, you're on the menu. The way that you shift that is to really be in the space and be able to affect policy change, be able to affect change in access, finance, even trying to make sure that people have the resources to be able to be in these programs, because they're not cheap. It's not cheap to become a Black doctor or a Black nurse or a individual in the healthcare space. It's not cheap. So we have to create avenues for people to be able to do that.
All righty. When we return, we're going to talk about some of those resources and actionable steps to make sure that we're changing the narrative, as you put it, when it comes to Black people in the healthcare system on both sides. We'll be right back.